basics. We're going to go now into one of the things that they mentioned here was I'm going to steal the turn of the next speaker, but you see, the whole idea of prediction. It could predict things, you saw it there. It could personalize things for you, AI can do that. And it also, as this portion is for us as medics, to look at how do we protect our clients, how do we protect the patient. So by essentially prevention and things, and of course policies and all that. And we have no one better than Dr. Stéphane Bolla. Dr. Stéphane Bolla is, he's going to introduce himself here, but I want to say that he heads a group called Cameroon Artificial Intelligence Digital Innovation Laboratory, which operates in the UK and Cameroon. I think that already gives you the snippet. So Dr. Stéphane Bolla, who heads a string of educational activities across various schools and in the southeast of England, from Woking and all over. Dr. Stéphane Bolla is also a prince. Like today now, I don't get cheap as moderator, so I'll hear all this. He's a prince like me. Dr. Stéphane Bolla, you've got the mic.
Thank you very much. Good morning, everyone.
Good morning.
I am Stéphane Bolla. I am very honored to be here this morning, and I've never felt so safe because I know I have doctors, medical doctors, nurses, so I'm absolutely certain that whatever happened to me here, I'll be safe. So thank you very much. Well, it's not a party yet. Thank you. I currently work as Director of AI and Digital Innovation across 7 colleges, which together that gives me around 14,000 students. So it is my job to not only ensure that colleagues are using AI as they should be using it, but also to bring about the digital innovation within those 7 colleges. I'm a computer scientist by trade, so I tend to understand some of those things. I am tasked this morning to talk about the 3 Ps. The 3 Ps in terms of how they are applied in healthcare. And I would like the session to be interactive. So I'll be hoping that people will raise their hands to answer the questions. So let's start. I'll start with a statement, and you're probably going to hear this statement throughout the conference today. AI will not replace healthcare professionals. It will not. However, healthcare professionals who use AI effectively may outperform those who do not. And I think that's a very powerful statement. If you're following AI or the news or technology news this week or last week, Ford sacked 100 engineers and then hired or built 900 AI agents. Within 1 month, they called back all the 100 engineers to come and train those 900 AI. I can tell you for sure that it has nothing to do with Lexia, because Lexia wouldn't behave that way. So you need to be fully ready with AI. I tend to use the following. If you're not AI ready, you're probably AI illiterate, but more importantly, you are an AI risk to your organization. More importantly, you are an AI risk to your organization. So what if? As health professionals, you are able to predict symptoms before they actually happen? What if? What if you are able to personalize treatment for every single patient? We know that, yes, you have fever, but the paracetamol does not always work the same way for everyone. So what if you're able to reject the one-size-fits-all? What if you are able to prevent illness before hospital appointment? Those are the questions, and I strongly believe that that feature is here. The healthcare system faces a lot of challenges across the world. What are those challenges? Question to the floor. Cost, time, access, human resource, patient demands, doctor, no, oh. Anybody else? Expectation. And you're absolutely right, because the World Health Organization tells us the healthcare system across the world are facing some of those challenges. And you will know that, even though you work in the Gulf, you will know that. You will. So why does this matter? Why is it important? Why is it important that because of all this pressure now onto the healthcare providers, does it matter? It does because we need to be moving into AI that has emerged as one of the defining technology over the 21st century healthcare. AI as a technology. AI as a technology. And the World Health Organization says that it does have the potential to increase not only equity, but provide implementation. Implementation will have a lot of difficulty in terms of ethical, transparent, and human-centered. That's the other side of AI. Because I did say that if you're not AI ready, your colleague will outperform you, but you're also a risk to your organization. And you know you don't want to be a risk. If you're a risk, you need to be managed. And if you need to be managed, that's too much work for someone. They might just find someone who's ready. So let's introduce the 3 Ps. Now, the literature has recently identified 3 dominant when it comes to that. We have the predictive, we have the personalization, and then they are saying, the literature says, not Dr. Bolla, literature says that, the computer says yes, computer says no. The literature actually says that AI can contribute to preventive healthcare. Should I continue? Okay. Fab, thank you. Okay. So not only that, I need to go a bit further. Thank you. So AI can support personalization in terms of medicine, but AI can also contribute to prevent some of those diseases. Now, this has been done purely on something that we call in research a conceptual approach, supported by narrative literature. So I picked up some peer-reviewed health research, some from International Organization report, the NHS Digital Transformation Initiative, and some published AI healthcare case study. Now, this is what the hope is that we can then develop a practical conceptual framework to help everyone to manage that. The key message here is that it's simply an attempt to synthesize existing evidence to provide a practical framework for AI adoption in healthcare, rather presenting a new empirical research. Don't go and say that Dr. Bolla has presented something here is empirical. I'm saying I'm not doing that. I'm simply saying that I've picked up a lot of things and then put them together so that we can actually share some knowledge together. Prevention. Now, we all know that you go to the doctors and the doctor goes like, how are you today? How are you feeling? Tell me another symptom. Tell me another one. And have you had this one also? It is argued that's reactive. But these two guys down there, they're actually arguing that healthcare is now evolving from reactive to be predictive. So reactive healthcare often intervenes when it's probably too late. We want to be able to predict that. And we think AI as a technology actually gives us that opportunity to be able to predict before it does happen. AI enables healthcare system to become more predictive simply by recognizing patterns. AI can estimate future risk and support earlier clinical intervention. Rather to say, I'm standing here, my leg has been hurting for the past 2-3 weeks, because your medical or your healthcare professional has all your data, they're able to put it into a technology called AI, which can actually predict, and then you receive a phone call, say, maybe you need to come to hospital. Essentially, I am saying that the patient's home becomes his hospital before you get into hospital. Now, AI can analyze vast amount of data. We've saw that earlier with Ulyssia, with early cancer detection, stroke risk, cardiovascular risk modeling, patient deterioration, and hospital readmission prediction. You can tell, okay, this patient will have to go back to hospital. He will have to go back to hospital because the technology is available. And how do you know that? It's because data is actually telling me so. Good morning, Mrs. Smith. I think we need to go back to hospital tomorrow. And that's what this technology is doing. The future of health is not about waiting for disease to appear. It is about recognizing risk earlier, acting sooner, and preventing illnesses where possible. And AI will be helping us to move to treat some of those diseases to protect health. That's the technology. We want to be able to predict. And that was my reflection, essentially. I was saying that, yes, AI should be able to help us to do so. Now, the next P is personalize. We put on the side. Yes, paracetamol is for you have a headache. We were saying that it's not always effective for every single person. How do we ensure that this one actually works? So we know every patient is unique. We know that. Just like students. They don't all have the same capability. We know that. AI-enabled precision medicine through some of the genomic personalized prescribing. And I'm saying here that rather than applying identical treatment to every single patient, clinician can increasingly deliver the right treatment for the right patient at the right time. Because you're able to personalize it, courtesy of AI. And that's the direction of travel. For example, in the case of diabetes, predictive algorithm identify individual at high risk of developing type 2 and allowing preventive lifestyle intervention before the disease actually onset. I'm not the one who says that. It's the Diabetes Association who says that. Mental health. Again, here we can analyze records, check whether it can be relapsed or any self-harm, enabling earlier support. Also here we can analyze. Do I need to admit anyone online? Okay. So again here, AI can analyze pathology and medical imaging, identify what could be coming from the onset. So we're actually personalizing that. And there are some numbers that you probably can read by yourself. It says 80% of rare diseases have a genetic cause, and AI is like to do that. I'm not saying that, that's what Ali and Mahota are saying. Approximately 1 in 5 cancer worldwide could potentially benefit from that. That's why that researcher is saying. And the International Diabetes Federation are saying that 537 million adults worldwide are living with that, creating significant opportunity for AI-driven personalized monitoring and treatment. So the technology is there. It is there. But are we ready? Are we at risk? Are we outperforming our colleagues? Or we are still shying away so that thing, I don't understand it. Just on the side, those of you who are as old as I am, you remember when Google first came. This is what we used to do in the classroom. As soon as the teacher says anything, we're going to type it onto Google. Those who love mathematics, you also remember when the calculator first came. Teacher of mathematics in the USA actually marched. We don't want to hear about calculators. This is my reflection. Not two patients are exactly alike, and you will know that as healthcare professional. Their genes differ, their environments differ, their lifestyle differ, and so do their health journeys. AI gives us the opportunity to move beyond treatment disease to treating people. So you have that opportunity there. Now, the prevention, obviously. The greatest opportunity for AI lies in the preventing disease before they occurred. And if I look around the room, in fact, I heard CamDoc chair saying that they need to go and do some steps. We have a lot of wearables. So we are doing something that I call voluntary tracking. So we actually wear a lot of devices which are actually telling us about our heartbeat, which are telling us how many steps we've done, which are telling us how we sleep. Remote patient monitoring. A lot of pacemakers, King George Hospital, for example, in London, they're able to monitor how people's heart are from a distance. Smart devices continuously monitor heart rhythm, oxygen saturation, physical activity, sleep and falls, shifting healthcare from hospital into patient's home. Your home is actually a hospital because you're wearing something with technology, and then the technology that you've got there is AI, which actually push data somewhere. And I do hope that you don't particularly share some of those data with your mobile phone manufacturer or provider. Now, we're going to branch a little bit because when I was preparing this, I thought CamDoc, Cameroon Doctors Association, maybe we need to think about Africa, and particularly Cameroon. And the reason is very simple. I strongly believe that Africa does not need to copy Western healthcare. It has the opportunity to leapfrog directly into AI-enabled healthcare. And I'm saying this, while adoption is often discussed with high-income healthcare system, low and middle-income countries may derive even greater from those benefits. And Cameroon is one of them. And I like Cameroon very much because the mobile phone penetration in Cameroon, we didn't have to wait for line to go and drill a hole in your wall and put a line there. But you see data in a minute about how much mobile phone users in Cameroon. So we have that opportunity in Cameroon. Cameroon illustrates this opportunity of low income, although we have some of the challenges there, that we have less specialists, rural population, limited diagnostic services, long travel distances. I know, and data is actually affirming this, wherever you go in Cameroon, even in remote villages, there is someone there with a mobile phone, with connection to the internet. We didn't have to wait for line. We have them. So we have that opportunity. Although we have those challenges, there are opportunities. The data says that 2.5 million mobile phone connection in Cameroon. What's the population of Cameroon? 30 million. 25.5 million. So nearly everyone has a mobile phone in Cameroon. That's early 2025, representing nearly 83% of the population. 2.4 are actually using the internet. giving that a penetration of 41.9%. So we have also the opportunity in Cameroon in terms of using that. In fact, without wanting to cite it, I know some medical doctors who are actually more or less well connected in that respect, where they check few things, they copy it, send it to their colleagues who are in cities in towns like Douala or Bamenda or Bafoussam or Yaoundé to cross-check, because there are some remote villages. So we have that opportunity. This expansion of mobile phone connectivity and smartphone adoption create a lot of opportunities. So we can have AI-supported medicine, maternal health care, remote diagnostics. I've just mentioned some people who are doing that. And I'm saying that rather than replicating traditional healthcare infrastructure like in the Western world, African nations may leapfrog directly towards an AI-enabled healthcare. And the reason why I mention it today at this conference is because it's a CamDoc conference. So we have that opportunity to actually leapfrog in Cameroon or in Africa. Now, this part is quite interesting because when I walk into my GP surgery, there will be some sort of compassion. But AI technology is all about computation. The reason why I've put this particular one together as part of research is to show that one consistent finding throughout the literature is that AI performs best when supporting, not replacing clinical expertise. I did mention earlier that I'm a computer scientist by trade, so it's much more easier for me to AI to write code, but because I know what I'm looking for, if AI isn't doing what I need it to do, I know it immediately. Healthcare remains fundamentally human. Empathy, ethical reasoning, communication, and professional judgment cannot be automated. Yet, at this point. AI should therefore be viewed as an amplifier of human ability rather than a substitute for clinician. So AI isn't here to replace you. But do you remember that? It will not replace you, but some colleague would outperform you. For discussion here, the 3 Ps provide a simple yet comprehensive lens through which healthcare professionals can understand AI. You have the prediction to improve earlier diagnostics, you have the personalization to enable precision medicine, and you have the prevention to reduce disease burden before illness actually develops. Together, these 3 dimensions shift healthcare away from episodic reactive care towards more of proactive patient-centered healthcare. And you will notice this has been quite recent into the NHS. Allegedly, that should save around 43 minutes. And that's a lot because there's not enough time in like in many other professions, there's not enough time. So NHS England has rolled out 365 Copilot, is one of the AI, to be more than 500 staff. And they are saying that not only for healthcare professionals, but also for admin staff, workflow reducing routine and triage, that will save around 43 minutes, which is really good. Ways forward, healthcare organizations should prioritize these 5 strategies. They need to develop AI literacy. The reason is very simple. If you are not AI literate, then you become a risk. They need to strengthen governance. Very, very important. You can't just pick up someone's data and then dump it into your own AI when the company has actually given you their own AI. Invest into digital infrastructure by doing what is written there. Promote global equity that support AI in low resource settings throughout mobile technologies and affordable digital health solutions. And maintain human-centered care. AI should augment, not replace clinical judgment or compassion. That's very, very important. And we're going to conclude. Hopefully I've got more time. AI represents one of the most significant developments in modern healthcare. Rather than viewing AI solely as a technological innovation, healthcare leaders should recognize it as contribution through prediction, personalization, and prevention. Ultimately, the future of healthcare lies not into choosing between human and machine, not to choose between human and machine, but combining human intelligence with artificial intelligence to deliver safer, more personalized, and more productive care. And this is my final reflection. AI is not about replacing compassion with computation. Because as human, we have the compassion. When I come and see you as a doctor, or I'm going to see a nurse who's talking to me, there will be some form of compassion there, not computation. It is about empowering healthcare professionals with better information, better insight, better tools to develop safer, more personalized, and more preventive care. And I'll sign this off with, the future of healthcare belongs not to artificial intelligence alone, but to human intelligence enhanced by artificial intelligence. Work hands in hand. Thank you very much. Do I have time? Thank you.
Thank you, Dr. Bolla. And as we said earlier, we had the basic introduction. Now we've done a little bit of deep dive into the 3 Ps. The 3 Ps is quasi-evangelization. Those who have been following the Young Professional Cameroon Mentorship scheme that, again, is run by CamDocUK will know that 3 Ps is what the gentleman saying. You get him up, it's second nature to him, really. So we've got some time for some quick questions. And can we just focus on this presentation that Dr. Bolla has given? Because we have a panel session at the end of this conference where we're going to have over an hour to drill down. So you raise your hand, and Dr. Colin has a roving microphone with him, and Dr. Bolla would then be taking the responding to the questions.
Thank you.
Thank you, Dr. Bolla.
Could you say your name and then your question, please?
Cheers, yeah. My name is Celestine Voma. I'm a general practitioner working as a partner in Blackpool. And yeah, thank you for a lovely and thought-provoking presentation. My little question, first of all, I am a fan of science fiction movies, quantum computing, and the like. So I appreciate this concept of what looks like a utopian future. I would like to be there. And my question about that is, what sort of time frame are we going to be able to live in this utopian setting, given the challenges around personal data, confidentiality, the energy demands of AI and quantum computing, because the AI feeds on what data we put there. I understand we need data centers now, even in space, to get as much data in as possible to teach the AI, for the AI to be able to help us and all of that. So is it going to be in 10 years, 15 years, 20 years before we leave this dream?
Okay. Thank you. I think the dream is here. I think it's reality. I'm sure it's reality in your office, it's reality at home, it's reality on the street. I mentioned Google earlier. We used to do a lot of Google. We used to go and Google it, and then Google used to give you the answers. And we had more or less the same, I wouldn't say resistance, but the thinking that this is not something that will be sticking around for some time. AI is actually moving very quickly, and it's very difficult to put a time frame on that. Although AI is new, AI started around 1956. This is new. Or even 1922, if you go further down. If it's as old as I am, I actually learned about maybe 25 years at university about AI. So it's not new. It's probably new because someone has decided to put money making onto it a few years quite recently, and nearly everyone is talking about it. So we are into it. We can't put a time frame onto it, but something is very clear is that it's evolving, and it's evolving very, very, very quickly. Now, you mentioned that the data that we input there, and this is where AI governance comes into, because we need to be very, very careful as to what we actually key in or don't key in there. And that's where organizations need to have some sort of AI governance in place so that as a user, I don't become an AI risk. And I don't think it's something we're going to resist for a long time, because before we know it, it's going to be something that we're using. If I'm using it every day, knowingly or unknowingly. So there will be no time. It's going to continue to evolve. I haven't got statistics with me here, but when AI first started, it was doing a lot of hallucination. And there were a few words that it couldn't quite spell right, but things have changed and changed very, very, very quickly. Thank you.
Yeah, I'm a Theodore Ngachu. I'm a retired gastroenterologist running a medical center in Cameroon.
I don't know how you can retire and then run something, but yeah. Maybe it's a hobby.
I did not say I was tired. Right. Now, I think you mentioned something that to me sounds very interesting, and that with the development of AI, Africa can actually leapfrog some stages of development. And I think we see that in the financial markets, where mobile money is very much widespread in Africa than you have in Europe. And I think AI might be one of those things as well, to leverage some of our deficiencies or bypass some of our deficiencies. My biggest concern, which I don't know if you can reassure me, is in our society, we have a variety of expressions. The way people express in medicine, we deal with symptoms and people talk to doctors complaining of things. And the way people express themselves is so, so varied, from one person to another, from one town to another. Do you think that that barrier, that mountain, is something that AI can actually bridge to make that healthcare use easy for the African markets?
Thank you. It's very interesting you mentioned the use of mobile phone with money transfer. And mobile phones have penetrated Cameroon and Africa in a very interesting way, and people have been making good use of that. But I can also say to you, in terms of the way how people express themselves, that I'm working with the Nigerian Artificial Intelligence Lab, and one of the things we're working on is about working on Yoruba and Igbo, so that it can actually do some of those things in that respect, which simply means that AI will quickly learn how to pick up accent, how to pick up emotions, how to pick up, of course, we're going to still lack that human side of it, but with the amount of data that's actually been inputted, like your colleague GP mentioned earlier, the AI will be able to learn some of those things and learn them very, very, very quickly. I have a very simple explanation when AI first started. In fact, it's called generative AI. And I always take the case of a worm. A worm. You've all seen a worm in Africa. We tend to chop it into 2 or 3. But what does happen when you cut it into 2, they regenerate, right? That's exactly what they call generative AI. So it's not something that will disappear. It learns very quickly to regenerate, and it will learn all these emotions. It will learn all these ways of expressing each other. And when this started, many people didn't actually know that you could try and do some Yoruba or Igbo. And even Basa, which I am, I've tried that on some of my AI, and it does work. Another thing that I need to say is, you can create your own agent and then train it that way within some of those well-known AI, like Copilot. You can create your own agents there that will be answering the things that you want them to answer the way you wish them to answer. So we're getting there. Is technology that is fast-pacing. Clearly, it's just like the law that is also catching up with it. So if we don't actually keep abreast very quickly, we'll be losing sight. So yes, we'll be getting there. Thank you.
All right, thank you. My name is Jean-Claude Kate. I'm not retired, I'm just starting. So, yes, so I think my question really it's about what you said lastly about creating AIs for specific use cases. And you've talked about prediction, personalized medicine, prevention. Those are things that we do already in some form And in research, using basic models, whether logistic regression, we are able to predict, we are able to do most of these things. AI comes and would certainly augment in terms of volume of data and everything. So, but for me, the real issue, especially if I look within the Cameroon context, is how do I work in the field of diabetes research. How do I create and train AI for local use, like for diabetes care in Cameroon? I don't know if this is the session to talk about that, but I think that practical approach on how we can leverage existing AI or even create from scratch, that would recognize our local problems, the different representations that we have, and then solve them. So,
I know the answer to that question, but what I will try hard not to do is not to say something, and I will ask Louis to answer that question, because he has clearly shared a model with you guys, and I understand clearly how that works, but I would rather not go into that direction where it's feasible. Louis, yeah, thank you.
Can I, please, if you don't mind, we are very concerned. Dr. Kate, your question is absolutely vital. After the previous two speakers, you'll see how relevant it really is. We are really concerned for time because we're going to move into low resource setting later. But it's important that we should look at, I'm sorry, Liz. It's important that we should focus on this wonderful tool. We want now to move into, you remember we started with the basics. We've addressed the 3 Ps, essentially. I think the key message that's coming from this is issue about governance. As he himself said, the 3 Ps, essentially, he calls for governance and strengthening. Because if those who might remember what happened in the Middle East, the 150 school children, those are the dangers of AI. The one who ended up with a bomb because of the fact that this whole drone was driven by AI. Some people seem to have not been following what's happening in the Middle East. So that's the dangers, clinical governance, the governance. But let's look at now where he has drilled on the 3 Ps. Having drilled on the 3 Ps, we want to try and ensure that we move on to back to the clinical setting. And so if we just have a last word from you, and so that we can then move on to the clinical setting, Dr. Bolla.
Yeah, absolutely. So I just want to thank everyone. Thanks for your questions. I'll be standing around if you have more. Thank you very much.